Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. This show is dedicated to you, the healthcare consumer. And today we have a very interesting topic having to do with men in nursing, which is something that you may not know a whole lot about because you don't see that many men in nursing. The title of our show is 7% and Growing, Men in Nursing, the image today and the opportunity tomorrow. And we have a renowned guest from Philadelphia, the University of Pennsylvania, who is going to tell us about this and educate us about this today, and I will introduce him in a moment. But the 3 things that we are going to review today is that men in nursing are really helping to break down stereotypes because men in nursing are caring and compassionate. Surprise, surprise. But we are going to talk about the nuances of that because many people don't necessarily believe that's true. The second is that we are using our men workforce in nursing to really help to target some of the issues in men's health, and men in nursing can often do a very good job of opening up those conversations with other men. The third aspect that we're going to be covering today is that men bring gender diversity to our field of nursing. That our nursing profession has been predominantly nursing has been predominantly a woman's profession since its inception. And we are now really taking a look at that and looking at the changes that we feel are really very positive and will be very helpful to everyone. So let me introduce our guest today, who is Chris Lance Coleman. And I want to give you some background on Chris because he is a very well-educated and national spokesperson for this and other topics. Chris is now at the University of Pennsylvania, and he is the co-director of the Center for Health Equity Research. And what health equity research is really looking at health equity, meaning everyone gets the same kind of health, everyone has the same kind of treatment options, etc. That's a whole show in itself, and maybe Chris and others that he works with will come back and really educate us about health equity. But he is the co-director of that research center at the University of Pennsylvania School of Nursing. He also teaches psychiatric nursing, and his field of expertise is HIV, particularly in African American patients. His background is in nursing, started at Walla Walla University, which is in the state of Washington. And he got his baccalaureate degree in nursing there. He then went on to Oregon University, where he got a master's degree in family and child psych nursing. Then he went on to UCSF, University of California, San Francisco. Beautiful city, yes. Loved it. I lived there for a year, it was wonderful. He got his doctorate in quantitative measures of the quality of life. So a lot of what he is doing is looking at illness and measuring the quality of life of people that have certain illnesses. And then he finished his formal education at Johns Hopkins University, where he got a master's in public health in epidemiology and infectious diseases. So Chris, with your 4 college degrees, you are an expert in many, many dimensions of healthcare. And another reason where I think Chris will make his mark in our discussion today is that he just authored a book that came out in May of this year, 2013, Man Up, a practical guide for people who are thinking of going into nursing. And he's going to refer to this book because we were talking about, how many books are there about men in nursing? And I think there are less than what you could count on one hand. So he is really, paving some new ground with just even having this book. So welcome, Chris.
Thank you.
And I think that what will be of interest to our audience today, and all of you that are watching this show, is not only to have a better understanding of care delivery and how you will meet hopefully more men in the care delivery, but also this would be a good show for those who are counseling young men, high school counselors or teachers, or those who have influence like parents over choices, what kind of choice of a career. And as I was saying to you, Chris, before we started, there are a lot of jokes out there, about men in nursing, and part of what we want to do is dispel that.
Yes.
So why don't we start with you? Tell us how you got involved with this profession.
Well, Dr. Nancy, so years ago when I was a college student, my roommate became ill, and we ended up going to the emergency room that night. And I remember when we first got there, I was just mesmerized by the nurses because they were running around, but in particular, there was this one nurse who caught my eye. And there was a trauma going on at the time, and this nurse was managing the trauma and telling the team what to do and telling the doctors where to go and telling everyone else which instruments she needed. And I was so mesmerized by her that I had to meet her. I just had to meet her. And so I kept waiting and waiting, hoping she would come to our emergency room bay where we were sitting, and she actually came in there. And I was just taken back, and I asked her, I said, how did you do all this? How do you remember how to do all these things? And she just looked at me and said, in time, in time, in time. And she looked at me and she put her hands on my face like this and said, you know, I said, I want to be just like you. She said, no, you're not going to be just like me. You're going to be better than me. And that, I thought, wow, I just felt like I was touched by this celebrity. And after that, I thought, that's what I want to do.
That's a remarkable story.
Yeah.
Well, it sounds like you were touched by an angel.
I was touched by an angel. I certainly was. And she was my angel that night because she really just, you know, she was what I needed in my life at that point to know which direction I needed to go.
Boy, that's a wonderful story. I think we all could use that at different points in our lives. That's a beautiful story. In terms of what actually happened that evening, I mean, your roommate, was he seriously ill? I mean, did everything work out and you felt she was part of that process?
Yeah, she was part of that process. And the wonderful thing is this nurse came into the room and was just absolutely caring and talking to us, looked at all of us, paid attention to each of us, got to know us. You know, she knew we were all anxious about our friend and if he was going to be okay. And the first thing she said to us was, he's going to be just fine. And she said it was such reassurance. And she went out of the room and came back, and he was fine. We were able to leave with him that night and go back to college. But it was just an incredible experience that she took the time. And here I just seen her out there with this trauma case running around, and this person apparently had suffered a gunshot wound, and she was managing that, and they went from that to us.
Right.
It was pretty incredible to watch someone just go in and out of these different complicated situations and just do it with such grace and elegance and self-assuredness. And I thought, wow, that is something I would love to be able to do.
That is a beautiful recounting of something that really did change your life. What were you studying before that experience?
Well, I was in one of those students that wanted to do everything. I was interested in law, I was interested in medicine, I was interested in just anything in the health profession. I had, taken all these interest inventories that they used to give us back in college to help us decide on a career choice. And interestingly enough for me, all of my inventories came back to the health professions were the place for me, something in the health profession I was to choose. I didn't know it was going to be nursing. I really had no idea it was going to be nursing. But that night at the ER, when I saw that nurse, that's what did it for me. It was just seeing someone in action doing something. I thought, that's what I want to do. I want to help people. I want to take care of people. I want to help make people's lives better.
Right. I think I'd like to just, underscore that point, Chris, for our listeners, because so much of what gets blurred in day-to-day life is all the jokes and that kind of, the sexual stereotyping around that. But what you just told us is a real experience, seeing reality in action. And that is what really made the difference for you.
It is, yeah.
And so I think it's really important to underscore that point.
Absolutely. It was that reality.
Yeah.
It made a huge difference for me. And it led me to telling my parents that I wanted to become a nurse.
So was that a challenge?
That was a challenge. That was a challenge. That was probably the most difficult night I had, because I can remember that night to this day. It was raining, and I went to the payphone to call home collect, as I typically did, to tell my father that I finally chose a career. I wanted to be a nurse, and my father literally dropped the telephone after I told him this. My mom gets on the phone, and I said, Mom, is Dad okay? Where is he? And she goes, he'll be okay. And what did you tell him? I said that I wanted to be a nurse. And she said, okay, all right. And she just kind of said it calmly, because they really wanted me to go on to become a medical doctor or something along that line, a dentist. So my family had lots of hopes for me to do different things, and so when I broke the news to them, they weren't initially happy about it, and my father particularly was sort of disappointed. But then he came around eventually, and it worked out. But so I learned from that experience that if I had that challenge back then and how difficult, I remember agonizing in my head, how will I tell them I want to be a nurse? Then I said to myself, as I get into this profession and progress through, I'm going to be able to mentor other young men and to how to talk to their parents about nursing and to educate them about it.
Well, I thought that was very interesting, that when I was leafing through your book and looking at the table of contents, your first whole section is on consideration of becoming a nurse if you are a young man or a middle-aged man. I mean, you don't have to only be young.
Right.
And also how to really walk through those steps, how to really think it through, how to tell your parents, how to really be able to sort of stand tall, so to speak.
Yes, absolutely, and that's where a lot of guys are challenged, is that how do they tell their parents, I want to be a nurse? Because typically, in the media, nurses are still presented as females. And so when a guy says, I want to be a nurse, he may be looked at by his friends like, you want to be a nurse? You want to be what? Because a lot of folks out there just don't know what nurses do. And so we have to educate ourselves and others about this wonderful profession. And once we do that, the light bulbs go on. And I have seen parents go, wow, yes, I'm great. I'm glad my son is going to do this. This is terrific. It happened in my case with my father. So, and this was years ago. So I know that this is something extremely important in terms of educating yourself about what do you say to your parents? How do you talk to your parents about choosing this wonderful profession? And the person really needs to do their homework about what nurses do, all the different specialty areas that nurses have. And once they do that, they then are armed to then go to their families and talk to them about it. And that's where high school counselors come in. They can educate themselves about all the different aspects of nursing and help recruit young men into this wonderful field where they're going to get a job and make a wonderful career for themselves.
Right. Well, I like the passion that you are exhibiting in this discussion, because often you'll hear, I've heard a few examples anyway, where men will be interested in going to nursing because they'll say, well, at least I can get a job. At least I'll get a good, salary. That isn't the whole reason to do this.
Right.
I mean, it's a great reason to have as your third or fourth reason, but it's really the passion, the commitment, and being willing to undertake the education that's involved.
Yes, there's a lot of education involved. So you have to study hard and be disciplined and through the process, because I remember when I was in nursing school, I thought I knew how to make a bed. Your parents teach you how to make a bed. And I thought I knew how to make a bed just right. And so I had this nursing instructor who was military, and she wanted a nickel to bounce off that bed. And I couldn't do it right. You had to make it in so many minutes. And so she kept me there for that clinical time when everyone else left and said, you are going to stay here till you get this bed right. And she stayed with me the whole time, and I finally got it fast, and that nickel bounced. I was so happy when that nickel bounced off that bed. I thought, oh yes, I could become a nurse. I can do this. Because I remember agonizing, if I can't make this bed, I am never going to become a nurse.
Right.
And I remember saying this to myself at that time, and I finally got it. I said, yes, I got it. And that was just the beginning, but it was those kind of fun little milestones you have to learn in nursing school that really build on other things, build on your self-confidence, build on your ability to take in a lot of information. And it was just those little, the person taking the time with me and really not giving up on me and saying, you're going to get this. I'm going to stay right here until you get this.
Right.
And I'll never forget her as long as I live. She was an incredible instructor and somebody I still remember to this day that kept me in that lab, because if she hadn't done that, I don't know what choices I would have made if I didn't get that bed right. But I did. And that's what mattered at the end of the day.
Right, so getting that bed tucked and that nickel bouncing led to 4 college degrees. So, so somehow that really inspired you,
It
Chris.
did. The discipline that it took to do that in less than 5 minutes was, really what helped me in all of my endeavors along the way.
Right, that's great. Now, once you got your first degree at Walla Walla University in Washington State, and you became a nurse.
Yes.
What was the entry like into the clinical field? Did you have other challenges there?
Very challenging, yes. And we were at the time, as male students, we were specifically told that we couldn't do certain things. We were not allowed, for example, to work in OB. We were told that the patients would be uncomfortable if we worked in OB. or gynecology. We were also told that we had to be careful in the nursery with the babies because we might hurt them. And so we were given all this prepping, and none of us quite understood what was happening at the time because we were all young men. Like, why are we being specifically told this? And we were also told to be careful as we left patients because we might hurt them, and to make sure we smiled when we went into the room. And we were all so bewildered at that time because we didn't know, why are we being told this, and our female peers were not being told this. And so it was challenging,
Yeah.
and it was very, and particularly when we went into rooms to take care of patients, we got looks, and sometimes the patients would look at us like, "Who are you? Are you a nurse? Are you going to be a nurse?" And when we would say, you know, "I'm studying nursing," they would look at us like, "Why didn't you go into medicine?" I was told that by patients so many times. "Why did you give up on medicine?" Or, "Why did you choose nursing? Why don't you go do you're just doing this before you go to medical school, right?" And so it was just constantly being barraged by these things, and I was being very reflective, introspective at that time about this, my decision. Did I make the right choice? Why are people asking me all these questions? I didn't anticipate that was going to happen,
Right.
and no one told me it was going to happen.
Right. So you had to be a trailblazer, just
Yes.
getting your feet wet in your first job.
Yes, absolutely.
And Chris told me that that was in the 1980s, so it wasn't really all that long ago that those stereotypes
absolutely.
existed. When did it get better? It obviously got better at some point. When did it get better?
It got better for me because at some point I said to myself, you know, I belong here. I belong here, and we all belong here. I didn't see many people that looked like me. I didn't see very many men around. But I said, you know what? I found a profession where I felt that this is my calling in life, and I'm going to put myself into this because I wasn't going to work for a paycheck. I was going to work because I wanted to help people. I wanted to care for people. And I found for me that the minute I stopped worrying about all those other noises of things like, why did you choose nursing? Why not medicine? Why not this? At the end of the day, I began telling people because I'm right here at the bedside. I want to be at the bedside with you, and I want to care for you, and I want to get you better so that you can go back home to your family. And that was giving me so much satisfaction. To seeing patients get better because of the care I was giving them. That was remarkable. And then the first life I saved, that was remarkable, that I thought, wow, this is where I belonged.
Right.
And so I couldn't find anything else better to do at that point.
Right. But there aren't too many other professions where you have to constantly be explaining why you spent years of study and years of practice and you might have been something else. I mean,
Yes.
just to give you another example, I mean, I heard over and over again in my field, as a woman, white, Irish Catholic background, sort of fit the profile of like lots of nurses. But if you were intelligent, you were also challenged. Why didn't you go to medical school?
Yes.
You could have been a doctor.
Yes.
Why did you go for all these other degrees? You could have been a doctor. So
Right.
I think after a while, you just learn the pat answers to
Yes,
those questions.
yes.
But I don't know of, it would be interesting if we had doctors who were being asked, why didn't you become a nurse?
Yes, wouldn't it? Yes. That would be interesting.
I don't know if that'll ever happen in our
I
lifetime.
don't think it will, but I hope so.
But or the fact that if you have a doctorate, like you have a
Yes,
doctorate, I have
yes.
a doctorate in a different field,
Yes.
but that would never be seen as compatible
Yes,
with
absolutely
being a
not.
medical degree. It
Yes.
would always be seen as very much secondary to a medical
Yes.
degree. So you didn't quite really make it
No,
to be
that's right.
a medical doctor.
Absolutely.
But somehow we've weathered through.
Yes.
We've weathered through. So we're kindred spirits in that regard, that we got through it. So when you were telling us about, one of the points is that you feel that by bringing men into nursing and more men into it, through your influence and role modeling, that this will really help, healthcare in general by having more conversations with men and helping them to, talk more openly about their problems.
Yes.
Do you think that's a stereotype? I mean, do you think female nurses would say, well, I have men telling me about their problems. It isn't an issue. I mean, tell
They
us.
say that, but I will tell you, Dr. Nancy, that I also have, over the years, have female nursing colleagues come to me and say, would you go talk to this patient? Would you go talk to this male patient? There's something about him, he's not opening up to me. And so I have seen this firsthand, that when a man feels comfortable talking about his health issues, be it a blood pressure medication. For example, I had an African American patient. He didn't want to take his blood pressure medication because of all the side effects associated with it. And he would not discuss this with the female nurse. He would not tell her. So she said, would you go talk to him? I went and talked with him, and he came right out and said to me, this is why I don't want to take my medication. And so it was the perfect time for us to have this conversation about all the alternatives he had. And he really opened up to me about concerns about his marriage and concerns about not feeling like a man anymore. And he was able, I believe because I'm a male, to talk to me. And he felt comfortable talking with me about it. So, and I hear countless examples of that over and over and over again. So it is, to me, a real truism that men can improve the health of men in the hospital setting. Men are more likely to talk to another man when they feel comfortable and share open things. We can have that sort of guy talk with each other and at a comfort level, and it can have incredible health outcomes for people, particularly for men.
Right. I think that's great that your colleagues, were able to use that team approach.
Yes,
and
absolutely.
People have different skills, different attributes, and they were really able to call on you. I think the first key point that Chris told us about earlier, and I think his stories really are great examples of this, that men in this profession can be very clear in their caring and compassion. I mean, I was saying when we first opened the show that, why are we so surprised that men can be caring and compassionate? But I think once you put them in a uniform and you put them in a nursing role, people start to wonder, can they be as kind and caring and compassionate? So tell us about, after you got through the early days of, you've got to be, you can't deal with women in an intimate way in OB, obstetrical, having babies, or in GYN, having exams, or you couldn't be in the nursery because you were too big and you might hurt the babies. So somehow people sort of got over that after a while. But tell us more about the compassion and the caring part.
The compassion part really is remarkable because it's interesting that when a man comes into a room, I think that the typical stereotype is that men are hard-edged, they're uncaring, they're not going to be as gentle with a patient. And I think that men are every single day just killing those stereotypes, literally killing those stereotypes, because we are compassionate and caring, and we bring a different skill set, our life experiences and our experiences with our fathers and our brothers to the bedside. And so I think we are really shaping creating a different narrative out there that we are caring, we are compassionate for our patients when we come into the room. We do care, we do our homework about their medical problems, and we want to understand them so that we can help them get back with their families, whether it's a mother that needs to get back with their kids or whether it's a father that needs to get back to work. We are there, and we can help them in a very compassionate way. And I think all the men I have worked with over the years and women I've worked with over the years share the same compassion for this wonderful profession of nursing. Nursing just brings that out of you. I have yet met a nurse who's not compassionate about what they're doing. And if they're not, they need to think about other things. But certainly this profession brings compassion out. There's no question.
So I think what Chris is telling us, that in the art as well as the science of nursing, we can say, okay, science is science. Men and women would be, equally as good at learning the science part of it. But he's really speaking about the art, and I think that the art is taught as well, and that men are as receptive and as good a student of the art of nursing as would be women. So we really need to get over that as consumers if we have those stereotypical views. And I think what you're also educating us to is that there's nothing like the lived experience. So if people have had a male nurse and it's been a good experience, just as if they've had a female nurse, and hopefully that was a good experience too. Not every experience with every nurse is going to be a good experience, but we hope that 99.9% of them are.
We do.
That having that experience really is the best education.
It is. It is. And having somebody experience you as another human being, as a caring human being, is one of the biggest lessons and the biggest ways we can influence the public perception of nurses. And I think that's what we're doing every day.
Right. But when you were educating me that 7% of the profession of nursing is men. I've been using that 7% for the last 20 years. It hasn't really grown.
No.
And I guess I would ask you, what's the history of that? Why it hasn't grown? And then that would be a segue as to, we're saying that there are great opportunities in the future, and do you see this trend changing?
I do see this trend changing, and I think we can make a change. There are many nursing schools now that are really specifically trying to have programs that targeting male students in high schools to come into nursing, because it is a great place for them to find a job. And I want the consumers to know out there that high schools are a great place for guys to learn about the health profession, and in particular about nursing. So I do see that trend changing. Our students at Penn, for example, they go out to the high schools and talk to the young men, and they talk to them about all the machinery that nurses have to deal with in ICUs, for example. And you should see their eyes just light up. They can't believe that nurses do all these things, or that nurses work in the OR, or that nurses work in the emergency room. And so it's really all about educating them, because most of the time people get their education from watching television. That's all they know. So we're hoping that, you know, this program and other programs out there will begin to inspire high schools and colleges to really think about how it is you're going to attract men into our profession. And if we can do that, that 7% will grow.
Right. Do you think that part of the interest that young men would have once they really see, you know, the real life of nursing is also all the technology that we have now in healthcare?
Yes, absolutely. That will fascinate them, and it does fascinate the men. When we go out and talk to them about nursing and talk to them about all the different technology, that you know, the charts are all electronic now, their eyes just light up. I mean, and men are driven towards technology. I mean, guys have always been driven towards technology. And so it is a very nice way to get their attention and to say, yes, you get to do this, and you also get to be this caring and compassionate person and take care of folks and help save lives.
Right.
So it's an incredible, it's a win-win situation, I think, for the profession and also for the individual person who's thinking about entering nursing.
With all these efforts, you know, various states have these organizations that try to increase nursing in general, you know, for their state needs. But a few very innovative states have really put a lot of emphasis on trying to recruit men. There have been some very, very nifty campaigns in a few states. Now, with all the campaigns, with your book, Man Up, and your own experience, do you see that there are more enrollments? What are the statistics?
Yes, so for example, we have doubled our enrollments of male nurses at Penn. What we strategically do each year is make sure that we have the male nursing faculty at the, we call it preview week, and when all the students are invited with their parents to come out. And so we showcase ourselves. We also showcase our male nursing students. We have them come, and we have our Male Nursing Association, which our female students certainly are part of that as well. But they come and talk with the students and spend time with them about what it's like to be a nursing student, what it's like to go to the hospital. And so because of our efforts, we have doubled our enrollment of men at Penn. So we actually exceed the national average.
That's
at
great.
Penn, which is a pretty remarkable achievement.
Right. So, you know, school by school and statistically overall, there is really definitely a growth in enrollment.
There's a growth in enrollment, yes.
So it may take a while to move that needle on the 7%, but it's getting there.
It's getting there.
It's getting there.
Definitely.
Our third key point that you brought up earlier was that you feel that having more men in nursing really strengthens the workforce of the 3.5 million nurses. Just the workforce alone will be positively impacted by having more of a balance. Now, 7% is very small. It will take us a long time to get more of a balance. But as Chris said, you know, we're really making an effort to do that. If you were to speak to the nurses that are in our audience, what would you ask them to do to help really move this effort forward? Because many nurses are going to be watching this show.
Yes. And my fellow nurses, I would ask you to help us attract more men into nursing. And these are some of the things you can do. Be part of outreach efforts in high schools and talk to them about why it's so important, why there's this gap of men in nursing and how they can contribute to their profession. We have a nursing shortage out there, as you all well know. And so this is a perfect opportunity for us to enhance our profession, the strength of our profession, to help guys think about how they're going to contribute it in many different ways, at the bedside, administratively, or in other specialty areas they may just choose. So that is certainly one way. You can also help by helping young men learn how to ask their parents or talk to their parents about choosing nursing. As you heard, I was challenged by that when I was a young man. And no one had told me, this is what you should say to your father. This is how you should do this. What I learned subsequent to that is that if somebody had sat me down and educated me about nursing and talked to me about all the different opportunities that are there, I would have been better able to talk with my father about it then. So if this is something that you can do with your sons and with your nephews, you will make a difference, and you will help us to move that 7% forward. And I would challenge all of you to consider taking this on.
That's a great set of advice points, Chris. Thank you. Well, I want to thank Chris Coleman, Dr. Chris Coleman, for being with us today and educating me, as well as I think our audience, on all the values that are associated with having more men in nursing. We can really increase this with everyone's help and understanding. I really want to not only thank Chris for being our guest today, but I want to thank that unnamed angelic nurse that reached out to him so many years ago when he was in college looking for his calling, and he found it. I also want to thank your father.
Yes.
And certainly hats off to your mother. She sounds like the real peacekeeper in the family.
Yes.
And she really helped everybody to get on board so that we've got someone in the Philadelphia area and really on a national and worldwide scale. We have a wonderful leader in nursing, Chris Coleman. Thank you so much for being with us today.
Thank you, Dr. Nancy. I'm glad to be here.
Thank you. And thank you for watching. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.